Thank you for joining us for CNTV. I'm Brad Clonch along with Quin Tran. Families prepare for a new school year with COVID-19 still a concern.
What is COVID-19's impact on schools reopening, busing? What will learning look like in the classroom? We pose those questions to the Chickasaw Nation's Undersecretary of Health, Dr. John Krueger.
You're a dad, you're in public health. Would you send your child to school this fall?
Actually, we talked to our daughter a lot about what that would involve. So as it stands right now, I haven't seen all the plans that are out there for what our school district is planning on doing. The things I think we want to see in a school district that are going to make it safe to reopen. One, you must drop the community rate before you can send kids back to school. I can't say this any more plainly. You can't go back to school when rates are 10 to 12% in the community. You just can't. It's not safe because what will happen is you'll have those kids, they'll go back into close proximity, and we know the kids are great. My kid's a great kid, but she's going to pull the mask down, she's going to be around her friends, and she's going to get sick, and then she's going to get her teacher sick, or she's going to bring it home to us if we're not practicing something different inside our own household. And so that's why dropping the community rates, we would expect the rate to go up when kids go back to school, but I think there's things we can do to get kids going back physically in the classroom and then also decant part of the schools so that not all kids have to go back. Younger kids in general have to go back to school, because it's very difficult for younger kids to, emotionally and developmentally, them being able to stay on a computer screen, 8-9 hours a day is just not realistic. They're just not going to do that. And on top of that, they're not as at higher risk in that age group. But they also have problems with like social distancing and things like that. So, I think there's a way to keep those groups of kids safe, and we're thinking through all those scenarios. The CDC's done a lot of work on this and has recommended some guidance back to parents and other folks like that about younger kids. So if I had a younger kid, I think in general, if a few things can be put into place at school, I feel much safer. Older kids, I don't know the rationale, honestly. I mean, if you can do your classwork online, that's fewer people that can be infected. And that's exactly what my daughter is looking at doing, is doing most of the school online. Doesn't look like the clubs and soccer club. This is the biggest pain in my household is she's varsity soccer. If you knew how much work went into making varsity soccer for her, this is a huge sacrifice on her part to not do that. But again, we see when athletic teams are together, it's just transmitting virus like crazy a lot of times. We're seeing that in college sports. We're seeing that in high school sports. We're seeing that in club sports or just, community sports. So, those are high risk situations there. But I think to your point, no, our decision as a family was, if you want to return back to school, that's fine. However, there's going to be some rules about what you do here in the house and how you're isolated and how you stay. And you're going to get tested we're going to put you on a testing plan. The schools are going to have to figure that part out too, along with the public health officials about testing teachers, kids, et cetera. The cohorting of children is, I think, going to be really, really important. If you put everybody together, it's going to spread like crazy. And we won't, the bad news is it won't be the sick kids that are the problem. It'll be the sick staff, teachers, et cetera. School won't stay open very long. It's the same thing that would happen if I did that here in my hospital. You can't, it wouldn't necessarily even be the patients. It would be all my staff that would get sick and couldn't come in and take care of those patients. So I think those are the things that are going to have to be solved is how do you keep the kids cohorted? How do you test? How do you have ongoing monitoring? And then how do you socially distance and keep kids masked at school? And masking is an absolute must if you're going to go back in a classroom. But all those things, yeah, I think we can go back to school. Public's got to do its part, drop this rate in the community, though, before we do that. Because we can't go to 20% rates. I mean, we just can't. The hospital can't take it. The health system can't take it. Our public health services can't take it. Contact tracing can't take it. Nothing will work, and it will slam everything shut. And then that will be the only alternative, I'm afraid. School bus travel, that's going to be very, very challenging to keep a school bus from transmitting virus. You know, if you have a mask on, it'll help. Again, we have seen that that'll happen. But how do you keep, 40, 50 kids on a school bus to really keep their mask on? If I were on a school bus, try to keep, the windows, cracked at least so you have some air circulation. That's the same thing. If you're in a car with somebody, keep that air circulation through that car. If you have to ride with somebody in a closed compartment, try to keep air circulation on. I think if we don't put up some of these mitigation strategies in place at the school level, we'll have another big outbreak that will spread eventually to the broader community, that will start to overwhelm our healthcare resources, and just prolong the problem. I am all in favor, however, and I want to be very clear, I'm all in favor of kids going back to school. Absolutely. I absolutely want to see schools reopened, but we have to do it in the context of what's safe for the kids, but also what's safe for everybody else who supports those kids in schools and the parents and the rest of the community.
Dr. Krueger emphasizes the importance of wearing face coverings right now to prevent the spread of COVID-19.
Health officials urge people to wear face masks in public, especially when responsible distancing isn't possible. This summer marks the 10th anniversary of the Chickasaw Nation Medical Center. The ribbon-cutting ceremony for the state-of-the-art facility was on July 19, 2010. Over the past decade, the Chickasaw Nation Medical Center has continued to grow and meet the healthcare needs of Chickasaws and other Native Americans, from emergency medicine, diabetes, dental and vision care, to pharmacy, nutrition services, and more. During the pandemic, the Chickasaw Nation Medical Center has led community efforts in COVID-19 testing, contact tracing, and the care of patients.
The Chickasaw Cultural Center is also commemorating its 10th anniversary. Through this virtual celebration, Chickasaw leaders and citizens reflected on the history, vision, and growth of this beautiful cultural destination. Located in Sulphur, Oklahoma, the Chickasaw Cultural Center shares the tribe's unique story, heritage, language, traditional activities, and the talents of Chickasaw citizens. Hundreds of thousands of visitors have explored the Chickasaw Cultural Center over the past decade.
In the years ahead, we look forward to meeting even more new friends from near and far, as we remain committed to sharing the ongoing story of the Chickasaw people, our story, with all.
Chickasaw artists, historians, and others from across the country and around the world took part in this virtual celebration to honor the Cultural Center's 10th anniversary.
In other news, an Oklahoma landmark in Ada turns 100. The McSwain Theater celebrated its centennial anniversary with this special virtual event featuring the talents of area musicians. Many big names have also performed on this stage over the years.
Owned and operated by the Chickasaw Nation, the McSwain Theater is known as one of the state's premier entertainment venues. It's home to J.L. Stillwell and the Crossover Band. J.L. Stillwell tells us more about the McSwain Theater and its place in the community and her family's history.
The theater itself has been here since 1920. And my Uncle Paul Alford, he bought the theater back in 1991, I believe it was. And we opened in 92 with a country show. A live country show. He loved the Branson scene. He loved going to Branson, and he wanted so badly to put something here in Ada that could maybe compare to Branson. And so he asked me, would I manage that show? And I said, I don't know if I can do that. And he said, oh, sure you can. We put a band together. I did some auditions, had never done anything like that. And we started the show.
You're a fabulous musician. I love your voice.
I don't mind you having a good time.
What is it about the McSwain Theater and that stage that is a great venue for musicians, young and old alike?
Everyone, including the band and the singers and the audience, everyone is involved with each other. It's kind of like the old days. You know, they truly care. And that's what the McSwain is all about. It's family-friendly entertainment and putting people together that are from Moore, Norman, Oklahoma City, Durant, McAllister, Kansas, Texas, all over, you know. We get together as a family. So the McSwain it's a place where you can hone your skills. You can feel a part of a family if you don't have a lot of family. We're a huge family here. And you can come and share your talents with everyone else. The McSwain, we hold 574 people in the audience. The intimate feel that we have here at the theater, it just feels like one big happy family. The audience loves to get involved in the people that sing on stage, you know, the guests and all. They come out and they talk to the audience during the break. And it's just like, it's like a big reunion when they come here. You know, it's like the first time Darcy was here, she was really nervous, Darcy Lynn. And, you know, we made her feel at home and comfortable. And she was just phenomenal that night. And I think that's very important to make people feel a part of what's going on, you know. I try to make each one of them feel like they're the most important person on that stage. And the band does too. The band is very good to go over their stuff with them. If they jump from a chorus to the verse and to the wrong one, they go right with them. I mean, the band is very, the musicians are very talented, very versatile to what's going on stage at the time. The sound here is awesome. Mitch runs the sound, and he does a very, very good job at running the sound and making everybody feel like, well, they can hear on stage. And that's one of the things they say, man, I love to come here because I can hear everything I'm doing, you know? The Chickasaw Nation, they put great care into doing good equipment, good lighting, the things that you really need to have a great show. And that's what they did for us. So we're really excited about even getting to do the virtual shows. We're excited.
The McSwain Theater is such a huge landmark there in downtown Ada, Oklahoma. When the pandemic hit, so many closures and cancellations. It was pretty sad not to have our McSwain Theater open for the entertainment and the summer movies.
Yes, the summer movies, you know, I've had people either text me or message me on Facebook or whatever, you know, that they really missed bringing their children to the summer series this year. People that are season ticket holders, they say, we really miss y'all. We just need to hear y'all again, you know. We've heard from a lot of people, and it's been so nice to hear all the nice compliments and comments on how much they miss coming to the McSwain Theater. And so we're excited that we get to do the virtual shows. At least we're giving something to them, you know, right now.
We needed this virtual celebration so much, more than you probably know. What stood out to you about this event?
I had tears in my eyes. I was crying. I may cry here in a minute. I hope not, but it touches my heart. You touch people's lives every day, and you don't even realize it. But you need to thank the good Lord every day that you can do that, whether it's together in person or it's virtually. You know, right now it's virtually, and that's the best we can do. But we just want everybody to know that we still are right there with them. I know they're really missing all of us because we're really missing all of them.
The McSwain Theater has hosted so many wonderful entertainers and events. Look for more virtual performances there later this month.
A virtual showcase will feature JL with some special guests in August. Visit McSwainTheater.com and click on Events to get the latest dates and times for upcoming virtual programs. In our last episode, we shared with you the virtual announcement of the inductees to the Chickasaw Hall of Fame. These are outstanding Chickasaw citizens who have served and contributed to their tribe and communities. Over the next several episodes, we'll feature each of these year's 5 inductees, beginning with Miss Lillian Blackwood Fowler. She will be inducted posthumously into the Chickasaw Hall of Fame, recognized as a pioneer of vital programs for citizens.
Lillian Fowler was one of the first CHRs. She was a trailblazer and an example of what our CHRs are supposed to be: kind, caring, and willing to do whatever job needed to be done.
Lillian Fowler was born in Antioch, Oklahoma, the eldest daughter of Bryant Blackwood and Melinda Blackwood Gibson, an original Dawes enrollee. After attending Bloomfield Academy and Chilocco Indian School, she put her education on hold to pursue work, but returned to earn her GED in 1977 at the age of 57. Given the opportunity to serve as a community health representative, one of only 3 at the program's founding in 1969, Lillian's dedication proved vital to the program's success. She experienced firsthand the needs of Chickasaw citizens, especially Chickasaw elders.
If people didn't have food, she would go out and buy some, and she would take it to the people that needed it. She never spoke of it. She never told anybody about it, but we knew it happened because we observed it.
Ms. Fowler was proud of her service and her tribe. Her spirit of giving has been embodied in the Chickasaw Foundation's Lillian Fowler Memorial Scholarship. Her service to the community was recognized in 2005 with the dedication of the Lillian Blackwood Fowler Monument at the Pauls Valley Senior Center.
She didn't express it that much, but she had a service heart. She wanted to help anybody that needed help. Somebody with a great work ethic, cares deeply for the Chickasaw people. She was born in the Chickasaw Nation. She worked in the Chickasaw Nation. She stayed in the Chickasaw Nation. She served the Chickasaw people, and she's Chickasaw.
In the next episode of CNTV, we'll continue the series and spotlight another inductee of the 2020 Chickasaw Hall of Fame.
We're so glad you spent time with us today. We leave you with a musical performance from the McSwain Theater's virtual centennial celebration.
Some glad morning when this life is o'er, I'll fly away to a home on God's celestial shore. I'll fly away. I'll fly away, oh glory. I'll fly away. When I die, hallelujah, by and by, I'll fly away. Oh, when the saints go marching in, oh, when the saints go marching in, oh Lord, I want to be in that number. When the saints go marching in, give me that wartime religion, give me that wartime religion, give me that wartime religion. It's good enough for me. It will take us all to heaven. It will take us all to heaven. It will take us all to heaven. It's good enough for me. Some glad morning when this life is o'er,